Have you ever considered that some subtle changes in your body might be hinting at heart damage? In this video, we're going to reveal 12 unexpected signs that may signal problems with your heart. Being aware of these indicators is crucial because the earlier you spot them, the sooner you can take steps to prevent the condition from getting worse. Many people think heart trouble always arrives with clear, dramatic symptoms. In reality, factors like minor inflammation, hidden stress, or insufficient dental care can contribute to heart issues in a less obvious way. There's also a common belief that only older adults or those with very unhealthy lifestyles face heart damage. On the contrary, issues such as sleep apnea, chronic psychological stress, and neglected dental hygiene can all play a significant role, and the list doesn't end there. Want to find out if you might have overlooked heart concerns? Make sure to watch until the end because we'll also share simple lifestyle adjustments and medical treatments that can strengthen your heart and prevent further harm. Calf swelling. Our first sign is swelling or discomfort in the calf, which could be an alarming clue of peripheral artery disease, PAD, commonly linked to heart damage. PAD emerges when the arteries in your legs become narrowed or blocked, cutting down on blood flow. Identifying this problem early is vital, as it can reflect larger cardiovascular risks, including heart disease. If you notice swollen or painful calves, particularly when you walk or climb stairs, it's time to pay attention. Peripheral artery disease frequently stems from atherosclerosis, which is the buildup of plaque in the arteries. To lessen potential complications, it's best to adjust your lifestyle by exercising regularly, following a heart-friendly diet, and quitting smoking, in addition to seeking professional medical advice. Keep in mind that recognizing and treating these early indicators can be key in protecting your overall heart health. Sign number 2, gum bleeding. Could your bleeding gums be trying to tell you something about your heart? You might think this is just a minor dental issue. Perhaps you brushed too hard or skipped flossing a few times. But did you know that gum health is directly linked to heart health? Gum disease, also called periodontitis, is a chronic inflammatory condition that allows harmful bacteria to enter your bloodstream. Once there, these bacteria can contribute to plaque buildup in your arteries, raising your risk of heart disease and strokes. Because inflammation is a driving force in both gum disease and cardiovascular disease, research shows that people with poor oral health are more likely to develop serious heart problems. So, how can you protect yourself? The best place to start is with solid oral hygiene. Brush and floss every day to clear away bacteria before it can cause harm. Regular dental checkups allow you to catch gum disease early before it leads to bigger issues. But remember, oral care isn't just about brushing. What you eat and how you manage stress also matter. Eating anti-inflammatory foods and finding effective ways to handle stress can reduce the impact of gum disease on your overall health. If you have red, swollen, or bleeding gums, don't ignore them. Could your mouth be sending an urgent message? Your heart might be listening more closely than you think. Sign number 3, erectile dysfunction. Erectile dysfunction, ED, doesn't just affect your personal life. It can also hint at serious heart problems. ED can occur when there isn't enough blood flow to the penis, which often happens due to hidden cardiovascular issues like clogged arteries or heart disease. It's important to remember that the same blockages leading to heart disease can affect blood vessels in other parts of the body, including those related to intimate function. So, if you're dealing with this issue, know that it may not only be about intimate well-being, it could also reflect the overall state of your heart. Making lifestyle changes, talking to a doctor, and controlling other risk factors are critical steps in addressing this warning sign. Sign number 4, snoring or sleep apnea. Have you ever wondered if your snoring might be more than just an annoying habit? It could be a clue to something bigger, specifically hidden heart problems. Sleep apnea, characterized by pauses in breathing or shallow breathing during sleep, is much more serious than just loud snoring. This disorder interrupts your sleep cycle and reduces the oxygen flow to your body, placing considerable strain on your heart. Individuals with sleep apnea frequently deal with elevated blood pressure and irregular heart rhythms, making them more prone to heart disease and stroke. If you or someone you know experiences severe snoring or noticeable pauses in breathing, don't dismiss it. Seek professional medical advice for a proper diagnosis. Possible treatments range from lifestyle changes to using a CPAP device or other therapies. Addressing sleep apnea early can be a vital step toward protecting your heart health. Sign number 5, extreme weakness. Our fifth sign is sudden, severe weakness, a red flag symptom that may suggest a heart attack. This level of exhaustion isn't just typical tiredness. It's an intense, crushing fatigue that can appear unexpectedly. It's a warning that your heart may not be pumping effectively, reducing blood flow and oxygen delivery to organs and muscles. This symptom becomes even more alarming if it coincides with other signs of a heart attack, such as chest pain or shortness of breath. If you experience this sort of abrupt, unexplained weakness, immediate medical attention is essential and could be life-saving. Sign number 6, irregular skin rashes or unusual spots. Could your skin be sending you a secret message about your heart? When most of us think about heart health, we rarely consider our skin. Yet ongoing issues like psoriasis or eczema can be linked to heart disease. Why? Both conditions involve inflammation, which plays a big role in atherosclerosis, the buildup of plaque that narrows and hardens your arteries. In fact, people with psoriasis have a higher risk of heart attacks and strokes because their bodies remain in a chronic inflammatory state, affecting not just the skin, but also the heart and blood vessels. If you've noticed stubborn rashes, red patches, or scaly skin that refuse to improve with standard treatments, there might be more going on beneath the surface. While these problems may start on the outside, they can hint at deeper cardiovascular issues. The best plan? Consult both a dermatologist and a heart specialist. Keeping inflammation in check through a healthy diet, stress management, and proper medical guidance can help protect both your skin and your heart. Your body often offers small warning signs when something isn't right, so don't ignore what your skin might be trying to tell you. Sign number 7, unexplained nausea or indigestion. Unexplained nausea or indigestion can be more than a simple digestive issue. They might be pointing to hidden heart complications. During a heart attack, some people report sensations that mimic indigestion, nausea, or stomach discomfort, and these feelings often don't ease with common antacids. Why does this happen? Because in a cardiac crisis, the heart struggles to supply oxygen-rich blood to the digestive system, especially if this symptom shows up along with other signs of a heart attack, such as chest tightness or difficulty breathing. Don't ignore these clues. Seeking medical help swiftly can make all the difference in catching and treating underlying heart problems. Sign number 8, persistent hoarseness. Could a lingering roughness in your voice be hinting at a deeper heart issue? Persistent hoarseness can sometimes signal heart failure, a condition that occurs when the heart isn't pumping blood efficiently. When that happens, fluid can accumulate in the lungs, irritating your vocal cords or causing a chronic cough. Although it's easy to chalk it up to a cold or allergies, hoarseness that lasts a long time, especially if accompanied by shortness of breath or fatigue, may point to worsening heart function. If you've been hoarse without any obvious cause, it's time to see a healthcare provider. Your voice might be giving you an early warning about your heart. Sign number 9, loss of consciousness. Losing consciousness or fainting, also known as syncope, can serve as a serious warning sign of potential heart disease. It typically occurs when the brain doesn't receive enough blood, often because of irregular heart rhythms or blockages. It's particularly worrisome if fainting happens suddenly, without any warning. If it happens repeatedly, or if you also experience chest pain or breathing difficulties, seek medical attention right away. Early intervention can play a vital role in preventing more severe cardiac issues. Sign number 10, sudden or excessive sweating. Sudden or excessive sweating can be an urgent warning sign tied to serious heart issues. Heavy perspiration that appears without physical exertion may indicate a heart attack or other cardiac problems. This intense sweating often occurs when the heart is under strain, and it can accompany symptoms like chest pain, pressure, or difficulty breathing. Recognizing this as a potential heart-related warning rather than a harmless occurrence is vital. If you notice heavy sweating with no clear cause, especially alongside other troubling symptoms, seek medical attention immediately. Sign number 11. Unusual or prolonged anxiety. Unusual or long-lasting anxiety can be more than a mental health concern. It may hint at hidden heart disease, particularly if it appears suddenly or grows severe. Anxiety affects heart rate and blood pressure, which can point to an underlying cardiac issue. This is especially relevant when it occurs alongside other warning signs, like chest pain or breathing difficulties. Although there are many potential triggers for anxiety, it's important not to overlook sudden changes in mental or physical well-being. Seeking advice from a healthcare professional for both psychological and cardiac evaluations can be critical for overall heart health. Sign number 12. Decreased tolerance for exercise. A sudden drop in exercise tolerance can be a major indicator of heart damage. If you find yourself unexpectedly unable to do routine physical activities, feel overly tired during exercise, or experience shortness of breath or chest pain, it may point to an underlying cardiovascular issue. This occurs because the heart struggles to supply adequate blood and oxygen to your muscles, often due to conditions like heart disease or blocked arteries. If you notice a clear decline in your ability to exercise, make an appointment with a healthcare provider as soon as possible. Spotting this symptom early can be critical for diagnosing and managing potential heart conditions. Lifestyle changes to protect your heart. Now that we've covered the possible warning signs, let's look at how you can enhance heart health and avoid further damage. It's never too late to start making these changes, and even small, steady steps can lead to big improvements. Focus first on smoking, alcohol, and your diet. Cut down on saturated and trans fats, as well as high cholesterol foods. Instead, include more whole grains, fruits, vegetables, and oily fish, like salmon or mackerel, which contain heart-friendly omega-3 fatty acids. Keep salt intake moderate to help control blood pressure, and limit sugar to lower the risk of weight gain and diabetes, both of which strain the heart. Regular physical activity is just as vital. Aim for at least 150 minutes of moderate aerobic exercise, or 75 minutes of vigorous exercise each week. This helps maintain a healthy weight, reduce stress, and strengthen your heart. Keeping your blood pressure, cholesterol, and blood sugar at recommended levels is crucial. Staying on top of regular checkups and following any prescribed treatments can significantly cut your chances of developing heart disease. Quitting smoking and cutting back on alcohol also offer powerful benefits for your heart. Giving up cigarettes can quickly reduce the risk of coronary heart disease, among other advantages. Stress management, through techniques like mindfulness, meditation, or yoga, is equally important. Ongoing stress can intensify several risk factors for heart disease, so finding healthy ways to handle stress supports both mental and physical well-being. If you or someone you know notices any of the warning signs we've discussed, seek medical help immediately. Early detection can truly be life-saving. Don't wait for symptoms to appear. Be proactive by getting routine checkups, eating a balanced diet, exercising consistently, and avoiding harmful habits like smoking and excessive drinking. These steps can lower your risk for a variety of health issues, including heart problems. For more insights on keeping your heart strong and understanding how your body works, subscribe to our channel and turn on all notifications so you never miss a potentially life-saving video. Thank you for watching, and as always, may you enjoy good health, prosperity, and happiness.